Hey, everybody. Again, this is Jorge Briones in your show, What in the Health? And today we have some good people in the cabin. Thank you, Arlene, for being here, recording the live video on Facebook. And first of all, I want to say thank you to everybody that actually help us every day to reach our members, and especially the ones that make this possible, our carrier partners and all the clinics that we work, but especially the ones that we have in the cabin today, because I think and I believe they still have that prime service for our seniors. And today we have the pleasure to have Miss Cassy Nordes. I'm sorry, Cassy, again, sorry about that. And Sonia Garcia. They're going to be able to help us understanding a little bit more how the model or how the senior model works in the community, especially for the Latino community, because they are particular with SuVida Clinic. So no further introduction. Cassy, how are you? Sonia, how are you? How you guys are doing today, this Friday afternoon?
I'm doing good. How about you, Sonia?
I'm doing good too. Ready for the weekend.
There you go. Thank God it's Friday, right? TG, what is it? TGFI, whatever. The point is it's Friday, okay? So, all right. So, Cassy, tell us a little bit about, SuVida. Again, we had you guys in the cabin. I love the model you guys have. I actually think that you guys are so far the ones that, again, go a little above and beyond for our seniors. So, tell us a little bit more about SuVida, please.
Yes, no, for sure. We do go above and beyond, and I'm happy to bring Sonia with us so we can show exactly how above and beyond that we go. So SuVida is a new primary care clinic that focuses culturally on the Hispanic community. And as you know, Jorge, the Hispanic community keeps growing, but also so does a Medicare eligible people keep growing.
Absolutely.
What is it, like 10,000?
10,000 seniors every single month coming up to the market looking for options. And basically, some of them don't have a doctor. Some of them pretty much are completely clueless of what's going on their alternatives and where to go for their care. So, you guys are perfect for that, role or job per se, right?
Exactly. And the one great thing about SuVida that I think a lot of people underestimate and are very amazed that we bring to them is that their physician, their medical doctor is going to speak to them in a language that they understand. So if they're Spanish speaking, they're going to speak Spanish. If they speak English, they're going to speak English. If they speak Spanglish,
they will speak Spanglish too.
Spanglish
too. And one of the main things, Cassy, that, at the end of the day, like, for example, whenever we, confirm and go over again and again and again is, the main problem per se that exists in our seniors, especially like you said in the Latino community, right, is the point that said sometimes, what, I don't like my doctor, but I don't have any choice. I just have to go because I have to refill my medications. And one of the main things, as I said at all the times, is like, you don't have to go to your doctor if your doctor don't treat you well. You have the power to say, hey, I don't like you. I'm going to fire you, and I'm going to find a different doctor, right? And one of the main things that you guys have, Cassy, that I think is important is that you guys get into that personal level side of the patient, of the member per se, and you guys actually care. And I think that's for Sonia. But one of the things, Cassy, is that, and please correct me if I'm wrong, you guys literally are one-stop shop, right?
Pretty much, yeah. For primary care needs, we do a little bit of specialty work inside of our clinics, but on your primary care needs side, that we are a one-stop shop.
There you go. And how many locations you currently have in the Houston metro area?
So currently we have 3 locations. We have one in Aldine, one in Pasadena, and one in Spring Branch. And then coming in 2024, we will be launching in Katy.
Excellent, excellent. So for those folks that are in those areas and are curious about what SuVida concept is, we can help you at JWB. We can help you getting in front of a Cassy, in front of a Sonia that can help you understanding how the model works and how they can help you get in those extra benefits that eventually are going to be vital for your care. But no, now let's pass the mic to Sonia. Sonia, tell us a little about yourself. What is Sonia before SuVida and what is Sonia after SuVida?
Okay. So I actually come from Memorial Hermann. I worked there for 13 years.
Oh, wow.
I did the community benefits.
You didn't go crazy working for Memorial Hermann?
No, which I dealt mainly with uninsured patients, finding resources for them out in the community, a lot of undocumented. So this is a little different. I still provide the resources. It's just for a different population.
Absolutely. Now, whenever you said, you work with different communities and the undocumented people, like, for example, what is your point of view or your opinion? Like, for example, let's say, I don't have papers and I am sick and I'm going to see a doctor. Mm-hmm. Can you share a little bit like how that works whenever a person is in desperate help or in desperate need of health care and they don't have that option to get in front of a doctor?
So if they live in Harris County, they have the gold card, right?
Absolutely.
And that's always an option because it doesn't matter your immigration status to apply for those benefits. And there's also a lot of community clinics out in the community that don't require you to have status. And so they can get health care that way.
Okay, excellent. And now, why SuVida? What do you think is that big old impact or change that you came from a hospital to a senior model care like SuVida?
Because it's like Cassy said, as you said, it's a one-stop shop. Okay. So when it comes to healthcare, it's not just the healthcare; it's everything that comes with it, all the social needs that come. So if someone needs medication, but they also need food, they're not going to probably spend the money on their medication. They're going to go and spend their money on food. So that's where we come in to try to help them with all those resources so that they can take care of their healthcare needs as well.
Gotcha. So in your role, for example, what would you think it will be the add value whenever one of our seniors or one of our members come to a SuVida clinic, and what is your role specifically for those folks that come to you?
So I try to help them with those needs they need outside of the clinic as well as within the clinic to make sure that if they ever need something, they can always call me and I'm able to help them get in contact with the person they need to reach, whether it's the doctor, the pharmacist, if they need an appointment or if they just have questions regarding their medication, I can help them with those needs.
So in other words, you are that link between the extra needs the seniors have besides the medical side, right?
Correct.
So let's say, for example, whenever we have one of our seniors not able to qualify for, let's say, housing or let's say the food stamps, are you the person that pretty much handle that need?
So so the first step is seeing if they qualify for those resources that are out there. And if they don't qualify, let's say for food stamps to SNAP, then finding them food pantries that isn't a requirement for them to be able to get groceries.
And I guess you're pretty much doing all of these services at the clinic, correct?
Yes, everything.
So they don't have to go to the office or, wow, that is an amazing point, especially for those that are not able to get access to a health and human services office. Right now, still after everything passed and all the policies in place, some government offices is still not working 100% function, and they have to do it either over the phone or online. And whenever we talk about a senior, no disrespect to them, but put them in front of a computer is like put them in front of what? Something that they don't understand. So it's so important that they have a Sonia that will pretty much take care of that for them, and they will be able to get access to these other services and having also a quality service in the healthcare side as well. So now, tell us exactly how SuVida born, Cassy. How this amazing idea came into place.
Yeah, so our co-founders come from a background of working with OptumRx, United Healthcare. They've been in the Medicare industry, and they really saw the need of actually shaking up the healthcare industry. And so what better way to do that with this ever-expanding Hispanic community, bringing services to them in a language that they understand, and that they saw that if somebody is not receiving healthcare in a language that they understand, they're not going to go.
Wow.
Okay. And so not only do we do this from the provider standpoint, but for Sonia too as well. She is bilingual, as well as our other interdisciplinary care team members that help out in our patients' needs. For example, one thing that we implemented with SuVida that is totally different is that guia role, which is Sonia. I like to call her the bridge between our patients and the provider.
Absolutely.
And then also too, she also helps with if they have family members who need to understand our patients' healthcare too as well. She helps them understand that because our families are important in the Latino community.
Yeah.
And so if we can do that together, then we'll be successful and we'll be able to improve the health outcomes of our seniors.
Of the seniors. You touch a very important point, Cassie, specifically because, it is well known that sometimes, again, our seniors or the senior population feels like they're alone and they are, I don't want to use the word abandoned, but they feel sometimes that nobody cares for them. And that is one of the main points why sometimes their health decline and all the other stuff happens, like going to the hospital because of depression or their health decreases because they don't take care of XYZ conditions they have. And one of the main things that you mentioned, Cassie, specifically, being in the Medicare industry, you quite understand exactly how the system works, and it's so awesome to know or hear that a big company like United Healthcare, you said, people that had that background took the time to understand exactly how important it is for a doctor to speak their language and a doctor to pretty much care a little bit more. A great example on your clinics that I always brag about, Dr. Ordonez. This guy, pretty much since day one that I started with Medicare 10 years ago, I remember, every single patient adore him. And you say, why? It's kind of weird to see a patient saying, you know what, I like my doctor. The majority of cases that I see is like, I don't like my doctor, but I don't have a choice to change, or I just have to take it, But in your case, having an asset like Dr. Ordonez in Alden, right? Dr. Baquerano in Pasadena, these names, whenever you actually talk about it in the community, people like them. People said, oh yes, I want to go where Dr. Baquerano is. I want to go where Dr. Ordonez is, because they care for what I have, or they care for what I might need in the future. So that actually is a big old point to you guys, because the providers, like you said, they will worry. They will pretty much prevent them to be sick, prevent them to be in a hospital setting, and they also will have the addition to Sonia's services to help them get in these other things, like you said, pretty much, because, it's actually the reality. So the majority of the time, a senior say, well, I receive $1,000 on my Social Security income. I'm diabetic. My insulin costs $200. Guess what? I'm not going to buy the insulin because I have to pay the rent. I have to pay the food. I have to pay the utilities. And, having the resources, because the biggest problem that happens, that exists in the senior community, is not the lack of access. It's the lack of information. And sometimes whenever we agents come across to Miss Jones that, she's receiving $1,000 a month, and she said, well, I didn't know I could qualify for help for my medications, or I didn't know I could qualify for getting the Medicare premium that I pay every month out of my check back to me. So, and you came to say, hey, you might be able to get it because you're low income. Like it or not, you're low income, and you can pretty much just run an application through the state for all of these many programs that they have available. Having a Sonia on a clinic where they will pretty much grab your hand and apply for it, hey, that is a win-win situation. So, specifically, what else do you think in your experience, Sonia and Cassie, what else do you think is going to be a great point for our senior population to choose SuVida compared to other of the clinics out there?
Well, I want to brag on our guias, because I think that's really a game changer. And, for example, we had a patient who we referred them to a doctor. They didn't have the forms in Spanish. Okay. And so the patient couldn't understand to fill out the forms. So they told them, well, go home, take them to somebody who can help you fill them out, and we'll reschedule your appointment. Wow. Well, if it's hard to get in to see specialists. It can take about 3, to 4 months sometimes to get in.
The waiting time is great.
Exactly. So the first thing that our patient did was call her guia and said, hey, they're making me reschedule because I can't fill out those forms. The guia was there in about 15 minutes. Wow. The guia drove to the specialist, helped the patient fill out the forms, and they were able to see the specialist the day of.
What a great, again, I'm telling you, you guys literally, I brag the same way that you said right now, you brag about the yes. I brag with the fact of being in a relationship with great companies or great senior care models like yours and other ones that we work with, because at the end of the day, what we pretty much strive is to get the seniors what they need. And like I said, 10 years past, I have seen so many people not being able to get access to help because they think they don't qualify. But in reality, they do. And the only reason they don't have what they deserve is because they don't know how to apply. And having a Sonia that can help you guys with that is incredible. It is, I don't have the words to say how important, how big, how vital is to have a Sonia in a senior facility, medical facility, that they pretty much be able to help them. So guys, if anybody's interested in knowing a little bit more about SuVida, how can they get in touch with somebody that they can go check you guys out and perhaps become a patient with a SuVida clinic?
So they can stop in anytime, Monday through Friday, to any of our clinics, or they can call 888-4SuVida.
888-4SuVida. I know it's in Spanish, but you can, it's S-U-V as in Victor, I-D-A. And where you guys are located again? Can you guys tell us exactly where you guys are at in the Houston area?
Yeah, so if you want to meet Sonia, she's in Pasadena. We also have Dr. Ordonez in Aldine.
Okay.
And then we have a location in Spring Branch. And so currently that are open.
Excellent, excellent. And again, you guys at the end of the day have to understand, our job, our mission, like, me being 10 years in the Medicare industry, I know the agents that we have on board, basically, we do have a common thing that is helping our seniors, getting pretty much information they need, getting the resources that they pretty much have to have in order to have a better life, in order to have a healthier life. And, working with you guys makes our job easy, because whenever we have a member that is not satisfied with a doctor or they're not receiving what they need to receive, pretty much we have the pleasure to say, hey, with all confidence, go check this clinic out. Go check Dr. Ordonez. Go check Dr. Baquerano. Go check them out, because these people will pretty much be able to help you getting what you need, getting pretty much that diabetes under control, pretty much getting that money back into your Social Security check just because you don't know how to run that application, getting pretty much that extra help into your medications. Remember, there's so many programs through the government, there's so many programs through the state that people can get only applying to the right place. And again, having a Sonia that can pretty much do that job for you guys is incredible. So if anybody want to get in touch with you in Pasadena, specifically for the Pasadena area, what would be the number, Sonia?
It's the 888 number.
Yes, so it's still the 888-4SuVida.
888-4SuVida.
Yes.
Go ahead, Cassy.
And the reason why we do it that way is because once you become an established patient, you get your own personal guia that you're assigned to. And then once you have your own personal guia, then that's the phone number you get.
There you go. So with that being said, thank you so very much, Sonia. Thank you so much, Cassy. So this is your show, What in the Health. Until next time.